Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What does a high or low mean corpuscular volume 1105 mean? A mean corpuscular volume, MCV, is a type of blood test that measures the size of your red blood cells. It is included in a routine panel of tests called a complete blood count, CBC. For adults, MCV levels normally fall between 80 and 100 femtoliters, FL/R/N/R/N. Red blood cells carry oxygen through your body. A low MCV means that your red blood cells are smaller than average, possibly indicating iron deficiency anemia. A high MCV means your red blood cells are larger than average, which could indicate liver disease or a vitamin deficiency. /R/N/R/N. The interpretation relies heavily on other blood test results in the CBC. An abnormal MCV may suggest a health issue but cannot diagnose any condition on its own. /R/N/R/N. Illustration by Julie Bang for Very Well Health. /R/N/R/N. Mean corpuscular volume, MCV, is used to measure the average size of red blood cells, also known as erythrocytes. The term corpuscle describes a living cell, such as a red blood cell. /R/N/R/N. MCV is measured by multiplying the total volume of blood, both blood cells and plasma, by the proportion of blood that is purely cellular, referred to as hematocrit or HCT. That value is then multiplied by 10 and divided by the total number of erythrocytes, called the red blood cell count, or RBC. /R/N/R/N. The calculation can be mathematically described as follows: /R/N/R/N MCV equals HCT% x 10, RBC/R/N/R/N. The MCV test is not used alone but interpreted along with other tests in the CBC. When interpreted as such, the MCV test can be useful for /R/N/R/N. The MCV can also change with certain diseases and may be useful for diagnosing or monitoring conditions that cause a change in red blood cell volume. This includes liver disease, chronic kidney disease, and certain vitamin deficiencies. /R/N/R/N. The CBC is a routine blood test performed during a medical checkup to see if there are any problems with the composition or concentration of your blood cells. The MCV is one of many tests used to assess your general health. /R/N/R/N. However, the MCV can also be used if you have signs and symptoms of anemia, such as /R/N/R/N. A normal MCV in adults ranges from 80 to 100 FL. Even so, levels can vary based on sex and age and tend to rise as people get older. /R/N/R/N. This is evidenced by a 2022 study published in the Journal of Cellular Molecular Medicine which showed how MCV levels can change in otherwise healthy males and females as they age. /R/N/R/N. A low MCV means that your red blood cell volume is under 80 FL. Also referred to as microcytosis, this is characteristic of certain medical conditions, such as /R/N/R/N. A high MCV means your red blood cells have a volume greater than 100 FL. The increased cellular volume may be due to conditions that cause the increased destruction of red blood cells, known as homolysis. /R/N/R/N. To compensate for the loss, the bone marrow will start to churn out larger red blood cells, which have decreased function. This is known as macrocytosis. /R/N/R/N. Macrocytosis may also be caused by vitamin deficiencies that prevent immature red blood cells, called reticulocytes, from maturing. Instead, they become abnormally large and start to crowd out normal red blood cells, leading to macrocytic anemia. /R/N/R/N. Conditions associated with macrocytosis include /R/N/R/N. A normal MCV result can mean just that everything is perfectly normal. But it could also indicate a medical problem if other tests in the CBC are abnormal. /r/n/r/n Normocytic anemia is a type of anemia in which red blood cells are of normal size and composition but are simply too few in number to deliver oxygen efficiently. /r/n/r/n Iron deficiency anemia, anemia of chronic disease, and lead poisoning can all start as normocytic anemia but, over time, transform into microcytic anemia as more organ systems that contribute to erythropoiesis are affected. /r/n/r/n Normocytic anemia can also occur with conditions like /r/n/r/n MCV is useful for evaluating anemia and some other medical conditions. But it is not usually looked at alone. Instead, your healthcare provider will consider MCV alongside other things in a CBC to get a complete picture. In addition to anemia, MCV outside of an expected range can suggest lead poisoning, vitamin deficiency, or liver disease. /r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.